Welcome back. Patients with rheumatoid arthritis can have other parts of the body that are attacked or affected by the rheumatoid arthritis itself. When the back of the eye is attacked, it is called uveitis. When the lining of the heart is attacked on the outside, it is called pericarditis. When the lung is attacked, it is called a rheumatoid lung, and this can include scarring or rheumatoid nodules, etc. When the skin can get a little bump underneath the covering of the skin, almost like the size of a coin, that's called a rheumatoid nodule. And then finally, if the rheumatoid arthritis can attack the blood vessels inside the body, it is called vasculitis. And depending on where that blood vessel is how the disease is named. So if the blood vessels going to the fat layer and the skin layer are attacked, then patients can get ulcers. But the big three risk factors for rheumatoid arthritis, number one is heart disease. Hands down, patients with rheumatoid arthritis can get more heart disease. And this makes sense because some of the smallest blood vessels in the body go to the heart. And it makes sense that if these get diseased, then the heart suffers. Number two are infections, especially joint infections. Again, this makes sense. If there's a bacteria flying through the blood and now the joint space, instead of being nice and smooth, is irregular and rough, it's easy for the bacteria to latch on and get infections. Number three, cancer. And in fact, some studies show that rheumatoid arthritis patients get cancer 50% more the time than other patients do. And again, this makes sense because if the immune system is supposed to protect the body from cancer and it's overactive the wrong way, it's not doing its job. And that's why medications are important because then they push that inflammation down so the rheumatoid goes into remission. If that inflammation is not put down, then the patient does have an increased risk of cancer. And again, in rheumatoid arthritis, but also in other parts of medicine, there is a huge difference between a patient that has a disease and a patient that doesn't, a patient that has more disease and a patient that has less. So medications, even if they are risky, are better for this patient because they're bringing the overall risk down and they are life-saving. In this patient, you have a little bit more time. And then finally, in rheumatoid arthritis, especially when it comes to like pre-operative evaluations or assessments, what's very important before surgery is to make sure that the patient does not have any underlying heart disease that could interfere with the surgery, and also that they do not have cervical spine subluxation. That's a fancy way of saying that the very top of our vertebra, the very top of the spine, the two bones at the very top are loosely connected together. And this makes sense because we have to rotate our heads, we have to bend it back and forth. When those ropes or those ligaments get frayed over time in patients with rheumatoid arthritis, then what happens, it becomes very wobbly. And when a patient is put under anesthesia or put to sleep, their neck is rolled all the way back. And instead of those bones moving together, they actually slide back and forth. And when they slide back and forth like that, it can affect the spinal cord, which can be dangerous. So we will end here for today. Until next time.